Today I'm going to talk to you about osteoporosis, and we're going to do a comparison of two drugs used to treat this condition. To begin with, let's describe what osteoporosis is. It's a metabolic bone disease that's identified by reduced bone density and degeneration of bone composition that leads to an increased risk of fractures. The pathophysiology of it is an increase in bone remodeling rates of cancellous and cortical bone. You also have thinning of trabecular bone, which leads to reduced cortical bone thickness. Increased porosity in the cortical bone also contributes. The best way to diagnose osteoporosis is with a bone mineral density test. This is done with central DXA. It measures the bone density of the hip and spine with a machine for diagnosis. You can also do labs such as a CBC, a SED rate, a CRP, or a serum calcium. The first drug I'm going to discuss to treat osteoporosis is alendronate. Its drug class is a biphosphonate. Its mechanism of action is for biphosphonates to attach to hydroxyapatite crystals. When this happens, it leads to a decrease of osteoclastic activities, which equals decreased bone resorption. This process allows for increased bone mass. Possible drug interactions that you may see with alendronate are aspirin, NSAIDs, and antacids. With aspirin and NSAIDs, it may increase the chance of gastric ulcers. And with antacids, you don't want to take it at the same time as alendronate because it can decrease the absorption of the medication. Next, we look at the efficacy of alendronate. Biphosphonates are the first drug of choice to treat osteoporosis. They're a beneficial treatment in osteoporosis in postmenopausal women and also in men. Now let's talk about the safety of alendronate. There are a couple of adverse reactions that you may see with it. These include heartburn, indigestion, esophageal erosion, and ulcers. There are two uncommon side effects. You have ONJ, which is osteonecrosis of the jaw, and atypical femur fractures. Both of these are only usually seen with long-term use of the medication. Now let's briefly talk about the cost of alendronate. Retail price for alendronate usually starts out at about $11.70 for 70 milligrams of the medication, which is 4 tablets in 1 month supply. The highest price goes up to $77.40 for a month's supply as well. Now let's talk about the expected outcomes of alendronate. You should see a reduction in fractures, preservation of bone mass, and decreased bone remodeling. Now let's talk about the second drug for osteoporosis, denosumab. Its drug classification is a monoclonal antibody. Its mechanism of action is to mark the receptor activator of RANKL, which is a transmembrane protein. This prevents osteoclast construction or activity. It then inhibits osteoclasts and leads to decreased bone resorption. To date, there are no possible drug interactions with denosumab, according to evidence-based literature. Now let's talk about the efficacy of denosumab. It's the preferred drug of choice with patients with high-risk fractures. It greatly reduces the risk of hip fractures, non-vertebral, and vertebral fractures, and it also increases the bone mineral density of the lumbar spine. Now let's look at the safety of denosumab. There's a couple of adverse side effects. Hypocalcemia is the most common one, followed by musculoskeletal pain, and then dermatological reactions such as rash. It also has the same two uncommon side effects as the previous drug of ONJ and AFF. Now let's take a brief look at the cost of denosumab. The retail price starts out at $1,226.97. One injection lasts 6 months. The highest price isn't much more, it's $1,242.57. The expected outcomes for denosumab are increased bone mineral density, a decrease in the risk of fractures, and it also prevents the advancement of osteoporosis. When looking at osteoporosis, you want to consider the genetics, the environment, and the lifestyle. Genetic factors include bone mineral density. It accounts for 50 to 85% of bone mass. As far as the environment goes, you want to try to do things to avoid falls. Lifestyle, you can reduce fractures with a healthy diet and consistent physical activity. So to conclude this presentation, let's do a quick comparison of our two drugs. First, we have alendronate. The evidence-based practice says that it's the first line of treatment for osteoporosis. It's also the most cost-effective, But we also have denosumab. It's the drug of choice for high-risk fractures, and the evidence-based literature suggests that it retains more bone mineral density, but it's also less cost-effective. So in conclusion, I hope you've enjoyed this presentation and learned a little bit about two drugs to treat osteoporosis. Thank you.